Hi, my name is Dr. Andrea Auerbach. I am a DC, which is a doctor of chiropractic. I also hold an advanced certification, a CACCP, in pediatrics as well as perinatal care. We're very family-oriented practice because adults can go to a chiropractor, but so can newborns. And that might sound unusual to you because chiropractic kind of has a reputation for being good for back pain. And it is, but that's just one symptom that gets better with chiropractic care. So, if you are a mom having any trouble breastfeeding your child, then this is a very good place for you to be. In my office or in some chiropractor's office that does this kind of work. So, what we look for is something we call a subluxation. Now, a subluxation, that's our chiropractic diagnosis. A subluxation means that the structure itself is not in its proper alignment. So, in other words, maybe one of the vertebrae are out of alignment. If it's out of alignment, then that joint is not moving the way it's supposed to. So right off the bat, you're missing some movement and flexibility. Now, if that occurs in these upper vertebrae or in any of the cranial bones, and this one in particular, this is called the occiput, and that sits on C1. And very often when a mom is having some troubles, this is the joint that I find out of alignment or subluxated. Now, if it's out of alignment, it's interfering with the nerves. Now, the nerves go everywhere in the body. They control the muscles, they control your heart, they control your lungs, they control every muscle and organ and tissue in the body. So if any of these are out of alignment or in the pelvis or in the cranial bones, it can interfere with your 100%. So a mom will come in and they're wondering, why is this 100% healthy child having trouble and not being its 100%? So what I look for is what's interfering with this child's function. What's interfering with his or her ability to latch, to suck, to turn his head to the other side. Any of these things can occur because the bones are out of alignment. When the structure is out of alignment, it's going to interfere with your brain sending its messages down the spinal cord and out all of the spinal nerves. So, let's say the segment is not moving properly, okay? It's sticky, it's not moving the way it's supposed to, and it's putting pressure on these nerves. So, now the messages that are going to the muscles in the face, to the temporomandibular joint, the TMJ, which is actually a joint. Not TMJ also means there's a problem with it, but this is literally called the TMJ. So if there is something obstructing that nerve flow, not only aren't the muscles getting the proper communication, let's say, from the brain, they're also experiencing some weakness because the muscles are not feeding the motor of the face properly. The joint can be stuck. The neck maybe can't move the way it needs to move. So there's the restriction itself can make it very difficult for the baby to breastfeed the way it's supposed to, as well as the interference in the nervous system. Now, usually with something out of alignment here, we'll find something out of alignment in the pelvis. Now, the important thing is that this bone here, the sacrum, pumps, moves back and forth, because when it does that, it pumps fluid up to the brain. And the brain gets oxygenated by that, and then the cranial bones actually move slightly. For the baby and for every adult, they move slightly and they pump the fluid back down. So there are a lot of ways that the sucking reflex or the moving the head or the moving the jaw or even the tongue getting the proper communication from the brain, there are a lot of ways that this can be restricted. And a chiropractor is very highly trained, very gentle, and very safe. Very safe. There is a wiggle here and maybe holding for 10 seconds here. There's nothing safer than a chiropractic approach to this problem. The other thing I would recommend, if the child is diagnosed as a tongue tie, I would also go to the chiropractor first, because very often the restriction, again, is coming from the misalignment or something we call a subluxation, which is the interference into the nerve flow and the communication and the restriction of the joint itself that's not allowing the baby to function properly. Now, a chiropractor can help in a lot of different ways. You know, if there's a colic problem, many times the vertebrae that go to the colon are putting pressure on the nerve that goes to the colon. So I highly recommend any baby get checked because there's not always symptoms. You know, there's a lot of wellness care with chiropractic. But again, if there are any troubles with breastfeeding, I highly recommend to go to a pediatric chiropractor. It's different than a pediatrician. We do different things. And usually a pediatrician will actually recommend a chiropractor. They don't completely understand the whole process. So I'm always willing to meet with them and explain and work together. So thank you for your time. You can go into the ICPA, the number 4 kids, ICPA4kids.com, and find a chiropractor near you. Or there's many articles on that site to read. It's the International Chiropractic Pediatric Association. Or you could go on my website, yourparkslopechiropractor.com, and get information. Or give us a call, 718-399-1111. I will be very happy to explain to you, have a consultation with you, or recommend you to a chiropractor near you. We also have a nutritionist that can help you with letdown. You know, sometimes the mom's not letting down enough. Chiropractic usually helps with that also. Thank you very much for your time.